also doing my job. So I continued my job in the government hospital. Previously, I was working in a rural health center, but I had a great proportion of patients, almost 300 patients to 400 patients daily, where I used to see trauma cases, gynecological cases, different medical cases that open my senses and the need of the patients for the presence of doctor. So I was enjoying that time, but I also tired a lot. And after that, from my job, I used to come home and study. With the COVID season, we were too much busy in the wards and were also very careful. I used to come from hospital and to isolate myself in the room rather than meeting my parents and siblings, because my mother is diabetic as well as my parents are old. They can get their immunocompromised. So it was very evident of the fact that I'm an adult, I can cope with the COVID, but my parents, if they get that infection, then it would be very hard for me to take care of them, and the things will be difficult. So I was isolating myself from the family again for a long period. As the exam centers were not opening in the end of 2020, the exam centers opened. I was preparing my USMLE. I started preparing my USMLE step 1 preparation again. Although I was studying slowly, but I felt that I was doing what I had forget most of the knowledge. So I realized, because I had in the start of 2020 shifted to a bigger hospital, a city hospital was the main center of a city, as well as there were 100 other villages who used to visit that hospital. A very busy job. There was a professor who was the MRCP and who had 28 experience of working in Saudi Arabia. He came to know that I was very passionate in checking patients and handling them and treating them. So he picked me as one of the favorite doctor, and he started teaching me to the level, and it really built my knowledge and skills to a level that I cannot even forget. He had built my knowledge to a level that I'm still today really thankful for his time and building his skills into my personality, my professional life and professionalism. So later I used to do emergency duties as well. I was rotating in medical ward OPDs, sometimes in pediatric and surgical wards I had to rotate. So the dialysis department I worked for many months. In the cardiology, I also used to feed OPD sometimes, and sometimes hepatitis C. I have also worked in hepatitis clinic, as well as sometimes we used to sit in trauma clinic. And I have a lot of experience during trauma cases, during the emergency ward duty, as well as in the general ward, as well as in the trauma OPD. So this was all of my experience. The other thing that I want to share about the step 1 exam, so I took a few weeks leaves to take my step 1, but as I started compiling my study, I felt that these few weeks were less to take my exam for step 1. I was not developing the confidence after those 2-3 weeks leave passed quickly, but I was unable to take my exam. I joined my hospital again. I thought I needed some more time, so I kept on doing my clinical rotations as well, duties in the ward, and I realized that I was unable to prepare for step 1, but I continued my struggle, and finally I took my exam in 2021. After that, I started preparing for step 2 CK. Although I was very confident about my clinical knowledge, but the reward of step 2 CK is very high-fi. I must say there is a lot of knowledge we don't practice, and there were a lot of new things that helped me to build myself professionally stronger than before. So I now a few people ask me to just do, you are clinically expert, so just do the CK quickly and take the exam. Then again I came to the point, no, I want to do those things practically and to apply on my patient, as well as I want to indulge in the knowledge of step 2 CK deeply until I feel that I am fully aware of the things, and this knowledge of step 2 CK has absorbed into my personality. So this was my style of study. I used to study step 2 CK from UWorld, and that knowledge, the new knowledge, and presenting a more professional way, I used to have with that knowledge to my patients. I started, meanwhile, I also started studying psychology, and it helped me greatly promote to help my patient through their psychological needs, because sometimes we have functional patients, sometimes with a real depression, and I used to spend hours and hours counseling my patients. When I started counseling my patient, it built my skills as well in counseling those patients very well. I used to become CBT of my patient, their family therapy, besides counseling them on the diseases to the patients and to their families. So I was a very good counselor besides that. So it was all real-time being in the hospital with a huge volume of patients. It was again I got laid with a CK. I planned to take my CK in March of 2023, but it went into the end of the year. In the third quarter of the year. Need any help, you can comment on. I will try to reach out and try to, if you need any guidance for the study or any topic, if you want me to make a video on anything based on my experience, I will must do that in my free time. Thank you so much for hearing me.